Okay, we're just gonna. Okay. How are you doing?
Good, thank you. You look like you're on the move. Where are you going?
We are on the move. My family and I were in Indiana, and then all of this flight stuff happened, and
Oh,
all of our flights got canceled, so we wouldn't be able to get home for like 4 or 5 days. So we decided to rent a car, and we're on day 2 of driving.
oh my goodness. What a
So sorry,
travel
I'm looking a
snafu.
little rough.
It's fine. All is well. I'm more interested in you than whether you're in travel mode or not. Yeah, yeah. So how long is this travel then for you?
Um, by the end of it, we will look at like 26 hours.
Right. Epic. And where are you coming from?
So we were in Indiana visiting family, and we live in Utah.
Oh, I see. You were in Indiana and you're going back home to Utah. Oh, Utah is such a beautiful place. I love it over there.
It
Yeah.
is gorgeous.
Yeah, I went on a road trip when I was 18 and it sticks out in my mind as peak geographic location to have visited. Yeah,
Yeah.
yeah, amazing. Well, thank you so much for making time, even while you're in the midst of this pretty intensive, unexpected travel experience.
Right.
Yeah. Um, so you got to know me a little bit, I guess, during the 3-day event that you just had an opportunity to catch up on. You watched the recordings, right?
Yes, I watched all three of them. Um, Pack full of information. They were great.
Oh, good.
Yeah.
I'm so glad. Yeah, so what are some of the key takeaways that you got?
I love that you showed video or pictures of the variety of different surgeries that happen, that you can come across. Yeah, I found that fascinating.
Amazing. Wonderful. Yeah. And you're a new therapist, right?
Yes, I just graduated in May,
Good.
and I'm just taking summer off. I'll have kids at home.
Audrey, let's try something.
At the kids before school starts. Yeah.
Let's just try turning off our videos because sometimes when the connection is a little bit patchy, to turn off the video will allow us to just talk and the connection can be more clear.
Okay.
Do you know how to turn your video off?
Yep.
Okay. Yeah, let's try that.
Okay.
Yeah, that sounds better. So
Good.
you just graded and right now, and then what did you say after that?
So I just graduated. I'm not working in massage right now, because I wanted to take the summer off to spend with kids and try to figure out my next move now that I have this degree.
Amazing. Okay, great. Well, I'm super happy to talk to you, and I'd like to spend most of our time together getting to know you and what your goals are, what you're looking for, and if anything that I have to offer fits in with your goals and the direction that you want to take your practice. And since you're a new person, then you're kind of at sky's the limit right now. Like you can direct it any way that you want. So that's a very exciting time to be investigating more targeted care, like what I have to offer.
Yeah.
Yeah. So I'll ask you first, what was it that drew you to the event and what were you looking to get out of it?
Um, I'm looking for a niche,
Okay.
and I then you came across my Facebook, and it fascinates me. I It feels like a lifetime ago, but I used to do breastfeeding education classes. I worked with
Okay.
a lactation consultant, So I know a lot about the breast anatomy.
Cool.
So that's always fascinated me.
Mm-hmm.
And then just to work with, possibly work with this population of surgeries.
Mm-hmm.
I, yeah, I just never had even thought about it because I don't know really the process of what these surgeries are like and what
Mm.
these clients go through emotionally.
Yeah.
Um, I think is fascinating because I just never thought about it.
Yeah, absolutely. So this was kind of an eye-opening experience for you to do the 3 days and to get a little glimpse into the world of what it's all about and how you can help.
Yeah,
Cool. Great. That's why I do the events so that I can introduce people to the work and then they can know, oh, this is a thing. This is actually an area of focus that I could bring into my practice. And it's really needed work. We really need therapists all over because there's patients everywhere who are getting breast cancer, who are going through different types of breast and chest surgery. And at the moment, there's not enough resources there. So it's very needed work. Plus, it's extremely fascinating. And since you're at the beginning of your practice, you haven't really gotten into developing your clientele yet because you've really only graduated a few months ago.
yeah,
Yeah, you've got an opportunity to just start a special focus in your practice right away and not get caught in what a lot of massage therapists get caught into, which is just doing the same style of treatment over and over and over again for years on end. Yeah.
yeah, yeah.
So if you were to
What
think about your
that
practice
out.
a year from now and you were, next summer 2025 and you were in an ideal scenario for yourself, what would that look like?
Yeah, which means, studying and someone that somebody is seeking out. I don't want to be just another spa massage therapist.
Gotcha. So for you, you want to be that go-to person with that elevated skill set and knowledge of how to help people. And you're not really that interested in being a generalist. You want to have a type of special focus to your practice where you get known for doing this type of work.
Yes.
Amazing. And what's your treatment style if you were to project yourself into the future and you were looking at how you were treating in terms of depth and pressure, what would be an ideal for you?
Yeah, I prefer lighter. Um, just going through school, uh, regardless of my proper body mechanics, just anything deep or too rigorous was just not my forte.
Right. So you're naturally oriented towards lighter touch
Yeah,
therapy. Yeah. And medical massage, it sounds like medical massage is more your route.
I think so. Yeah, I can see myself either in a hospital setting or going to patients' homes. Um, yeah,
Okay, cool. So doing the mobile massage is of interest to you?
yes, it is.
Okay, great. Mobile massage opens up a lot of opportunity for early post-operative care before the person's ready to go anywhere. If you can visit them in their home, then you're able to really get them on the right track from early on, which can make a huge difference to their healing.
Mhm.
Yeah, cool. So, what about the gaps that you see between where you're at right now and where you'd want to be a year from now? Are there any missing pieces that you can identify?
Oh, well, lots. I mean, most of the things that you touched on in the training of just having the experience and having the hands-on and mentorship and language with certain clientele. I feel I'm lacking, and yeah, just confidence in general.
Okay. Great awareness of yourself. That's wonderful. Any other gaps? I want to be sure that I can help fill you in on the areas that you feel like you need the most support.
I think start there, and hopefully some of that will fill into other areas that I'm lacking.
Yeah, absolutely. Okay, and then when you're learning, what's your preferred learning style? Do you like a download of information in a short period of time and you kind of take it and apply it on your own? Or do you like information which you have time to integrate and practice and apply with guidance over a longer period of time? What suits you better for your best
Option number
treatment?
2.
Option 2. Okay.
Yeah.
This is good. Yeah, this is important because matching people up with what suits them the best makes for the best learning experience.
Mhm.
Okay, great. And then if you were to get a really solid nugget, a key takeaway from today where you feel like, oh, I got something substantial out of our call, what would that be for you?
Uh, I Yeah, I really don't know. I mean, I know I want some more information on the training. I got,
Okay.
I had written down the first type of training,
Yeah.
but I didn't get any information regarding the 6-month mentorship training.
Okay. Amazing. So I can go into that now if this is a good time.
Yeah, yep, I have pen and paper and ready.
Okay, amazing. I'm going to share my screen. Even though my camera's off, you should be able to see these slides so that you have some visuals as well as auditory. So can you see this Mentorship and Training Academy 200-hour program overview,
Yep,
course overview?
yep.
Okay, great. Amazing. So this is very focused on breast, chest, and oncology massage. It's extremely targeted. There's no fluff information. There's no wasted information. It's all completely focused on being able to help this population. We do go into 3 pillars of learning and growth, and I covered some of this in the 3-day course. So you're going to have some repeat and some new information. So we've got our 3 pillars. We've got our main core curriculum, which is the 4 courses that make up the backbone of our evidence-informed training. We've got this beautiful supportive community of like-minded therapists who are all there to learn and make change in their practice and make a positive difference in the world. And then we've got help and support with marketing and communication so that you can reach out into the world around you and you can draw the clientele in so you can work with the people that matter the most to you. And I'm going to go into each of these 3 pillars a little bit more. So since you're in the US, this is going to be useful for you. The 3 of the 4 programs in the core curriculum are accredited. You're eligible for 39 CEUs from the NCB TMB. And that's going to be useful for your continuing ed requirements.
Okay.
In this core curriculum, it's designed to move you from beginner to skilled in a 6-month period. And we've got these courses that take you in a very strategic and thought out way from the beginning up to being able to offer complex care. So in the foundations, this is where you get everything you need for ethical and professional breast massage, breast and chest. So we start you out with some of the softer skills around mindfulness, training, the human-centric care, understanding the importance of doing this work. It's very heart-centered. And then we go into some of the protocols around entering and performing and exiting the treatment. So you've got this safe container for your patients, and they always know what to expect, and they know there's no funny business going on. We help you with your draping, your assessments, understanding how to take therapeutic images so you can track your client's progress as they heal. We go into language in this one fairly extensively, so you understand how to work with people going through breast cancer, the gender affirmation top surgeries. You can have conversations with people about what you're doing, because as you mentioned, language is important. And if language you're feeling like this is not my strongest skill, then we spend a portion of the foundations on how to talk about these sensitive treatments with sensitive populations, so you can gain some confidence there. And also hand skills for healthy breast massage. Also precautions and contraindications, so you understand what to work with and how to modify treatments or what to stay away from. And all of this tees you up for level 1, where we do the deep dive into 18 types of breast and chest surgery. 13 of those surgeries are related to breast cancer, so it's more weighted towards the breast cancer population, but they're not the only ones getting surgery to this area. So we also focus on the gender affirmation surgery and the elective breast surgeries like augmentations and reductions and lifts and those kinds of things. So what you got in the 3-day course was just the tip of the iceberg. We show you lots of videos, actual surgical videos, so you actually see what's going on. Lots of imagery so you understand the extensiveness of the surgeries, and that the scar on the outside is just the tip of the iceberg. You really need to understand what's going on under the skin in order to be able to provide quality, safe care.
Mm-hmm.
In level 2, this is where we go into the top 10 post-op complications. And, complications in North America, unfortunately, are not uncommon. And about 30% of people or so get them. And you need to know how to do preventative care, ideally, or if complications do arise, how do you mitigate them so that they're not as severe and they clear up more quickly? And also, sometimes patients don't know. They're like, is this normal? Should I be experiencing this? And you're like, oh, that actually needs to go to medical care. You need to refer them on to go to Emerge or their family doctor and get that looked at. And you have to know which is which. Really important.
Yeah.
And the 4th course, which is involved in here, is integrative cancer care. This is very breast cancer specific. Sometimes oncology massage courses cover all types of cancer, but ours just focuses on breast cancer. So you understand about the different types, the different stages and grades, and what does that mean, the different diagnostic procedures. So you understand about fine needle biopsies as opposed to core needle biopsies, for example, or when do they use ultrasounds versus mammograms, et cetera, all those things. Understanding how to work with chemo and radiation so that you're, again, a very safe therapist and you can help people with the side effects, useful products to use. There's lots of different aspects to this. So between all these 4 courses, at the end, you're very well set up to be able to support this population. But what I learned over the years of doing, because I started out just doing weekend courses, is that teaching this information for most people, it's just not enough. They're like, oh, this is fascinating. I really want to be able to help this population. However, I actually have no idea how to bring them into my practice and how to actually let people know what I'm doing and, how to create referral relationships. And, they're like, I need more help and support with this. So in the academy, we go a step farther, and this is where we get into the marketing and communication component, because we do want you to be able to make a difference in your local community. Like you were mentioning, being that go-to person where people know that you do this type of work, you're a safe therapist, you develop a name for yourself. This is where we help you with that component. So it helps you draw on new clients and forming those referral relationships. I know for a lot of people, reaching out to doctors and surgeons is very daunting. So we give you help and support on how to do that. And also, we do want you to do some presentations and participate in events in your local area. And we give you suggestions for things to look for and ways to reach out and to put your name forward. So you're totally supported as all this is going on. And definitely the fastest way to make change is with community. Trying to go it on your own, doing the trial and error method is a lot slower. And I had to learn through the trial and error method. I had to do it on my own. It took me a lot longer. So I'm like, the world does not have time for everyone to take a decade to get to the level where I'm at now. Yeah. So we've got multiple levels of support for you. So in terms of the mentorship, I'm there to give you guidance and to give you feedback on your treatments. There's group guidance and personalized guidance. And, you know, some calls, everybody in the academy is there. Some calls are just one-on-one, like we're doing right now, and you can ask anything. We've got the other peer group. They're all educated, like-minded professionals, amazing people. I feel so honored with the people who are stepping forward to be a part of this. We do set you up with some accountability buddies so that you've got a deeper connection with 3 people throughout the program, and that helps you stay on task, you know, execute the things that you need to A, finish the program, B, reach out into your community, and C, make the change that you're looking for. And then we've got this private community, which is only for the Academy members. It's not Facebook. It's not on any social media. It's just for the people in the Academy. So it's all your MG peeps, as we call them. And you can ask questions, you can message people, and it's a really safe container for you to ask anything and be supported with your whole journey. It's very beautiful. In terms of the learning, it's a combination. Most of it's taught live. So you show up for the live classes, but there's also on-demand options. There's different workshops. We've got this MG treatment library, which is like a video textbook, and you see the different techniques, and you can use these videos in your practice sessions. There's digital handbooks, or if you like printed handbooks, we can get those out to you as well. Class recordings, these are here so that you can revisit any material that you want. They were going over a DIEP flap, and you're like, oh, what was the difference between a DIEP flap and a tram flap? I really want to revisit that lesson again. Then you can go through and just access that recording and refresh your memory or go deeper on it. Or if you miss a day, because it's 6 months and sometimes life comes up, then you can just catch the recording afterward and do your self-learning, and then you can ask any questions that you want of me or your accountability buddy or the community at large. Action challenges, these are things that are inside the community, and we start you off with small ones like getting your treatment room ready so that you're able to have objects and have a presentation of your treatment space that's appropriate and supportive for this population, up to reaching out to different communities like the Pride societies or the breast cancer support groups, or maybe you're reaching out to local shops and services, reaching out to surgeons. Like there's different action challenges that we set throughout the program, and it coordinates with the core curriculum so that you're taking action in the world on what you're learning in the program. Does that make sense? Yeah.
Yeah,
and
that is huge. Yes.
Yeah, so big. Because like what I used to find when I was only doing the weekend courses is people, and I mean, I've had this myself as well, and you've probably had it, whatever your previous career was, where you learn something and you're like, oh, that was great information, but then actually applying it to the world is another matter altogether. And sometimes maybe you'll apply one thing or maybe two, but then the rest of it just sits on a shelf and then gets forgotten. So we don't want that to happen with this. We want you to actually, be able to apply and integrate and make the changes in real time.
Yeah.
In terms of the templates, there's so many templates that we offer. I went into them a little bit more in the 3-day course, but all of those are there so that you don't have to reinvent the wheel. It helps you with the language, with the approach, and they range from letters of introduction to your charting to doing different styles of events. There's tons of different templates that are in there, and all of them you can just customize to your personal information. So they give you a jumping off place, and then you can adapt it to whatever is specific to you. Saves you tons of time, and you don't have
Fantastic.
to. Yeah, it's so helpful. You don't have to think everything up from the beginning.
Yeah.
So these are 3 of our main workshops and related to your marketing. And we really focus on feminine marketing, which revolves around building relationships, because your people need to get to know you. They need to know that you're safe. They need to know you know what you're talking about. And that way, when they come to you, they're like, yep, I can let you into my sensitive areas. I can let you into, a part of my body that normally I would never let anybody touch, both because it's private and because it's been surgicalized and I don't want anyone to hurt me. So if you do your marketing by building relationships and creating those communication options, then people are like, I know Audrey. I understand what she's up to. I understand, these are the types of treatments that she offers, and I know that I can find what I need there. So in the first workshop, we show you how to understand your ideal client. In the second one, what platforms you can use to help get your message out there. And in the third one, how to do a social media calendar. So you can use Facebook and Instagram to actually pre-schedule your posts, and then you don't have to be thinking it up every time. Because I don't know about you, but I was trained as a therapist, not a marketer, and I had to learn marketing skills as I went along. And for most massage therapists, they're like, marketing, I don't know. I like being in my treatment room. Marketing is a challenge. Are you in that scenario, or what's your approach to marketing right now? Did I lose you?
You did lose me. I'm in and out. I'm sorry.
That's
I
okay.
lost. Yep, I'm there
Uh,
at the workshop.
okay. Yeah.
So
So I was
these
just wondering,
workshops, those,
yeah, I was wondering about your
part of
relationship with
the
marketing.
very little. I had someone who was doing the breastfeeding education classes, working with people. But other than that, very much.
Right. Yeah. So some help and support on that front would be useful for you, so you can understand how to get the word out there. And
Phenomenal.
okay, good. Yeah. So in each of these workshops, we help you with some practical things like being able to get your business cards organized, your brochures organized, being able to put your templates together so you can do like a month's worth of marketing within a few hours, just to make it all easier for you and so that you understand who you're talking to and what they're looking for. So in terms of the schedule, we've got the core curriculum, which happens every month. So you can learn and practice and apply the information and integrate it as you go along. For the mentorship, we've got the first half where we're really focused on practicing what you're learning, getting your marketing assets organized, so that in the second half, then you can reach out to the community and you can create your referral relationships. And you can also start to charge for treatments so that you can learn that how to do that when you're in the safe container of the academy. I think I keep losing you.
Yeah, that's my fault. I'm here though.
I think, yeah, it's just because you're on the road and probably the service alters depending on where you're at. Yeah. But basically we have it all set up so that you're applying and integrating the information as you go along so that you're able to be a beginner in the beginning, and then you're able to start charging for treatments, and you have assets when you're ready to reach out to the world. And by the time that you graduate, you've already got paid people that you're working with, so you're graduating with paid people in your book already.
Nice.
Yeah, it's very useful. In terms of specifics, we've got two styles of calls. One of them is longer, which is where we cover the core curriculum, and that's on Mondays from 10 to 4 Pacific time. Are you in Mountain Time?
Yeah, we're mountain.
You're Mountain. So it would be 11 to 5 on Mondays, one or
Okay.
two Mondays a month, depending on the month. And then the other Mondays are a shorter call where it's the mentorship group call, 90 minutes. So for you, that would be from 2 to 3:30. And we do suggest to reserve about 8 hours a week so that you can tailor your material and what you're doing to be able to do this in a digestible way. So you can continue on with your life, do all the things that you need to do. You've got your kids, you've got your family, all the other things that you have in your life, and you can do this course. Yeah.
Good.
And there's a couple of Saturdays and one Sunday, but by and large, Monday is your day. Is that a day that works for you?
Mondays for sure. Depending on Saturdays, I normally work on Saturdays, but depending on times and how many, I could probably make some accommodations.
Yeah. Okay, great. Yeah, we give you the schedule ahead of time so that you know how to organize yourself. I think there's altogether, there's maybe 4 Saturdays over the 6-month period.
Oh, that's
Yeah.
completely doable. Yeah.
Yeah, it's not that many. Mostly it's a Monday.
Okay.
Yeah. Now, after graduation, I do believe it is viable for you to give yourself a raise, because after this, you won't be just a generalist. Like you were saying, you don't want to do spa massage forever. You'll have an advanced skill set that will be above and beyond what a generalist can do. So if you wanted to raise your rate by $20 an hour, I do believe it's appropriate. This is a little vignette of how much you could earn. So if you were 5 clients a day, that would be $100 more per day on top of what you would get as a generalist. Potentially 400 more a week, 1,600 more a month, or 17 and a half more per year if you were going to work 11 weeks a year. So has the potential to A, pay off the program pretty quickly, and B, just put more money in your pocket, which I'm sure you could use. Everybody's, price of butter has gone up substantially. All money has gone up substantially. Yeah.
Right.
So before I go into the program investment, is there any questions on what we've covered so far?
No, not so far. You're very thorough.
Okay, good. So you feel clear?
Yeah, I feel clear.
Good. All right. Now, bear in mind, this is Canadian funds here. So the regular pricing is $800 a month for 6 months, plus a $500 commitment deposit if you're going to do the monthly payments. Or if you want to save your spot now and pay in full in September, same story. You put your commitment deposit down. Altogether, it's 5,300 Canadian. I do have an American breakdown so that you have more of an understanding of what that actually translates to in USD. But there are some ways to save. So if you want to pay in full within 48 hours, then you can save $800 overall. So the commitment deposit is no longer necessary because you're just saving your spot by paying your full tuition. Plus, you can save $300 on your registration fees. So instead of 5,300, it's 4,300 Canadian. And then there's some special bonuses for people who are able to do the pay in full. There's a special VIP day, which is a 3-hour group session prior to the academy start. There's extra video review, so you get more feedback on your practice sessions, because that's how I'm able to see what you're doing, is you send in confidential videos and then I watch them and I give you feedback. So if you are able to jump in one go, then you get some more feedback for your practice session. And there's also a home care short course so that you understand what patients can do to prepare for surgery, as well as regaining their movement afterwards from home.
Okay.
So in terms of the conversion, if you want to do, this is converting Canadian to USD. If you want to do just the one-time payment, it's 3,300 more or less. A monthly is 550, and the commitment deposit, instead of 500, it equals 368.
Okay.
Definitely friendlier going from Canadian to USD.
Right?
Yeah.
You did that on
Yeah.
purpose, didn't you?
Well, people like to know. People are like, what does that actually mean in my currency? So I laid it out for you. Yeah.
Yes. Okay.
Okay. So
Okay.
what's your thoughts after that?
Yeah, I'm still very interested.
Okay, good. If you were to
Um,
put yourself on a number, 10 is high, 10 is like, this is for me. I know this is for me. And 1 is like, no, this is not for me. What's your number?
I'm like 7, 8.
Okay, good. So what makes it a 7 or an 8?
Um, I think I don't just something new that is this intimate without being there in person. I think that I mean, I'm excited about possibly it being different, but just the video part of it. But you said that you would be able to watch us do a session, it being
Yeah.
videotaped.
Yeah, so I can explain what that process is like for you, if that would be helpful.
Yeah.
Okay. So you do 5 treatment videos, 1 a month. And we give you protocols for how to do that so that your person stays totally confidential. I don't get to see their identity, and they are able to practice in a safe session. I'm the only person who sees the video. There's nobody else whose eyes are on it. And we give you instruction on how to set up the camera, how to film it, how to, cover your person's face so that they can still breathe, but their identity is concealed. And then language that you use for recruiting people for the videos, so
Okay.
that people understand this is educational. It's an educational tool, and it's as you're a part of a mentorship academy. You're learning advanced skill sets, and you're doing practice sessions under the guidance of a mentor so that they can see what you're doing and give you direct feedback on your treatments. And most people understand. There's some people who are like, I don't want to be filmed. And then you just leave it at that. You don't push them. There's no coercion. It's nothing like that. But a lot of people are like, okay, yeah, I
Mhm.
understand what you're doing and why. And then they're okay. They sign consent forms so that they are very clear about what the videos are used for, what they're not used for, that they'll never be for sale. They'll never be used for marketing purposes. Nobody else will ever see them. They're protected, confidential information. We give you all that script so that you can we give you the whole form. Actually, it's not just the script, but yeah.
Okay.
So then you go over it with your person, and then they've got informed consent that they sign off on. So you're completely covered legally. They completely understand what they're signing up for and why. And then you upload the videos to Dropbox, and then you send us the link, and then I review the videos, and then I give you email feedback. But if you have a person who you want some more conversation around, then one of your mentorship calls you can use to discuss your video treatment if you like. And you time your practice person to what you're learning in the course. So in the first month, we only want you to find someone who's comfortable with healthy breast massage. They don't have to have had any type of surgery. You're just learning mindful therapeutic breast massage. And we want to see that you can enter the treatment well, that your draping is good, that you can exit the treatment, that your pressure is good, that you're able to apply the skills, just starting massage. And then for the next people, you're recruiting people who have simpler surgeries. So maybe they've had a breast augmentation or reduction, or maybe a lumpectomy. And as we go along and you get successively more complex surgery in the curriculum, then you're putting call outs for people with more complex surgeries, or people who've going through chemo or radiation. So it's timed. Your practice people are timed to the curriculum that you're learning at the time. Does that make sense?
That does make more sense. Okay.
Amazing.
Okay. Smart. Yeah. Okay.
Yeah. That settles your mind a little bit on that?
Yeah, it does. Yeah.
Okay.
Okay.
Good. Amazing. And what else? What else can we do to bump your number up? What other areas you have questions about?
Um, yeah, I truly, I just think I just need to sit on it. And I want to talk to my husband about it, obviously, money.
Yeah.
But no, I mean, I know I'm going to need to invest something to find a niche and find what I'm looking for, instead of just doing spa work. So I know there's commitment and I know there's time, and I appreciate that it's over a longer period of time so I can really wrap my head around it instead of just the fire hose method.
Yeah. The fire hose method, it works for a few people, but a lot of people, especially with advanced material like this, they're like, I need time to integrate. I need to know that I'm learning it properly so that when I'm in practice, I'm applying it properly. I'm not going to hurt anybody, and I'm retaining the information. And I've always got a focus on retention, because I don't want someone to learn just to pass the course and then they forget the information. For me, the purpose of teaching the courses is so that when you're in practice and you're in the room with the person, you feel empowered. You feel like you're confident that whoever walks through your door, you can problem solve with, you can critically think, you understand all the different presentations that a person could come with. And there's so much variance in this work that it never gets dull, it never gets boring. But because there's so much variance, you do need to have good critical thinking skills. And that's one of the things that mentorship has been shown through the research. It's really good at helping you develop those critical thinking skills so that you are able to assess a person on a case by case basis. It's not a one size fits all. Like spa massage is pretty much a one size fits all. It's very basic. There's nothing wrong with it. It's very useful. It definitely has its place, but it's not always the most interesting work. And for you, the way that the tone that I hear when you say spa massage, like I don't want to just do spa massage. It's like, oh my gosh, do I have to do that forever?
Right.
Yeah.
Yeah.
And the answer is no, you don't have to. It can be a portion of your practice if you want that, absolutely. But you can also flush it out with other populations and have some different qualities to your work.
I do have a question concerning like lymph work. Does it follow a certain technique, or is it on a case by case basis? Is it
I go
just in the
over,
chest area or?
yeah, so I go over basic lymph anatomy, understanding the watersheds, where the lymph system flows, how to be able to access the initial lymph collectors so that you can help the drainage happen anywhere in the body, but we're really focused on the breast and chest area. So it's mostly related to the upper limbs, but I cover in terms of basic lymph flow and watersheds, the whole body. And then when somebody's had lymph nodes removed, which is quite common, you have to understand the alternative pathways to take so that you can be assisting the lymphatic fluid to drain without overwhelming a compromised lymph system. So I cover it in a basic way, but if you want advanced training in lymphatic drainage, it's recommended to take VODR or Chickley's or one of those courses that are, 3 levels in itself in order to get the
Okay,
advanced lymphatic drainage. So I do a basic coverage of it so you understand a very useful basic stroke that's effective. You understand where the lymph flows, and then if someone's had lymph nodes removed, how to direct the fluid to other areas that can pick up the excess fluid so you're not overwhelming a compromised lymph system. Does that make
okay,
sense?
yeah,
Okay, good.
yeah.
Is that an area that you have a particular interest in, the
Uh,
lymphedema side of it?
well, I took a intro class in school, and I don't know whether it was the technique or the instructor that either one, it just didn't set well. And so, I mean, I'm interested in it, but again, I don't know whether it was the method or the instructor. So I didn't take the second class, but she was very informative of any type of drainage work, specifically with these surgeries and people getting the lymph removed. You for sure need to have extended training with that, or else you could really mess up their system.
Yeah, it's advised to do more advanced work if you really want to get into the working with this population. But with what we show you, you can absolutely work with the majority of patients that will come through your door. And then if there's people with a more advanced presentation than your skill set allows, it's entirely appropriate to refer them to a therapist who has that advanced training. And then you can continue to help your person with the scar tissue work, with pain management, with range of motion, body dysmorphia, all those things,
Okay.
functional movement, all those things. And then the combined decongestive therapist can be working specifically with advanced lymphedema.
Okay.
Yeah. Yeah.
Okay. Well, helpful to know that. Okay.
Amazing. These are all great questions. And I think getting all the clarity that you need is really important so that you can make an informed decision as to whether this is for you or not. Yeah.
Yeah.
So is there anything else I can help you with clarity on?
Not that I can think of right now. No.
Okay. So what's your number now? If you were out of 10, 10 high, 1 low, what would you say your number is now?
I'll give you a solid 8. How about that?
Okay. Okay, that's good. So, what if we meet again? So you have some time to talk to your husband, go over the finances, decide if this is good for your future or, what direction you want to take. And then we can meet up again.
That would be fantastic.
Okay. So what works better for you, Friday or Saturday?
I am going to have to get home and look at my calendar and see how my whole week is shaking out right now.
Okay. So, oh yeah, because you're on an extended travel trip. So I'm going to send you an email with the
Okay,
synopsis of what we talked about, and then you can think about it and you can let me know what is a good time for you.
okay, that would
Okay.
be wonderful.
Okay. Amazing. Well, I really appreciated your time and your willingness to explore a new possibility. And if you decide this is a route that resonates with you and it's going to give you what you need, then I'd be super happy to welcome you in. So we'll connect in a few days.
All right, sounds wonderful. Thank you, Erin.
Okay, thanks, Audrey. Bye for now.
Okay, bye-bye.